Good afternoon, ladies and gentlemen. Let me thank you all very much, members of the media, for turning up and covering us. Good afternoon to the citizens of Trinidad and Tobago at home and on your various platforms, wherever you might be. Today we continue our COVID response briefing, and I would like, in the normal way, to ask Dr. Roshan Parashram, CMO, to give us his initial briefing, and the staff would follow as we normally do.
Okay, thank you, Honourable Prime Minister. Honourable Ministers, colleagues, members of the media, members of the viewing and listening public, the COVID-19 update for the 13th of August 2021. We now stand at 286,821 tests done at both the public and the private facilities. Over the last 24 hours, we would have had 321 new positive cases, taking our total active caseload to 6,145. Total positive cases since March 12th, now standing at 41,528. Total patients recovered thus far, 34,216. Total people in hospital are now at 298, and Dr. Richards will go into a little more detail as to where those persons are. Step down at 97. Deaths now stand at 1,167. Total persons in state quarantine 134, and those persons in home isolation at 5,429. Dr. Hines will now go into the epidemiological update, followed by Dr. Richards with some more details in terms of the hospital statistics. Dr. Hines?
Thank you, CMO. Honourable Prime Minister, Honourable Ministers, members of the media, colleagues, members of the media, members of the viewing and listening public, good afternoon. The epidemiologic update with data as at 4 p.m. on August 13th, 2021 is as follows. If we look at our epidemic curve, with the colourful end being the data for 2021, we see that the indigo bars, those are the ones on the furthest right, those are the bars representing numbers of cases by date of collection of swab. And we do see that those bars do look a little taller than the ones in the month of July, which is the fuchsia bars just before it. Not a lot taller, but a little. So we're seeing where, although we've been commenting on a plateau, regular or a fairly stable number of cases, there is that hint or tendency towards a little bit of an upward trend. There is some epidemiologic dynamics that actually account for some of that, including some clusters that we have been tracking, tracing, and testing, which would make the numbers over the last week or so a little higher than they might have been in the absence of that cluster activity. So we see here that when you look at the week by week, the pink or fuchsia bars that represent the month of July, well, they climbed a little bit week on week, 1%, 5%, 8% sorts of increases, leveled out between week 29 and week 30. We saw that the first week of August, week 31, was a little lower than the first week of July. And then week 32, because of some of this cluster investigation activity that we've been having, has actually surpassed 31 by about 20% by the time we get today's data in. So we are also looking at the background, and the background being that salmon color, which represents the positivity, number of positives that you get out of every 100 COVID-19 tests that you perform. And that positivity we do see also being a little bit higher in this week 32, again linked to the fact that what we're doing is testing clusters of exposed individuals in certain settings, so that's raising that overall positivity. But again, we're monitoring the trend at a national level, bearing in mind that some of this cluster activity is affecting the national totals. If we look overall at the monthly cases, we see that we are manifesting and hopefully maintaining something of a downward trend from May through June to July. We have to see what happens with August. August seems set to keep pace with July, but again, that would be in line with the plateau that we're speaking about, but we are hoping that the continued adherence to those public health measures will continue to help us to keep the numbers as low as it is possible to do so. The general demographics have not changed significantly in terms of the age groups affected and the sex distribution of those positives. Largest proportion still in that 25 to 49 age group, approximately 50-50 in terms of percentage male and female among the positives. Among those who have passed on, we note the age distribution is different, being more heavily weighted towards the older population, more than 2/3 or so in that 60 and over age group, approximately 57% men, 42% women. And we did note that between maybe April and now, we've seen that sort of constant and consistent increase in the proportion of women among those who have passed on. So whereas it was 75% in the early part of the year, men, now it's down to about 57. And we continue to keep an eye on that general trend, but it's then more or less reflecting the distribution among those who are ill, tending closer towards that 50-50. If we look at the geographic distribution, what we see is for the weeks 30 and 31, that would be last week and the week before, we see that sort of where the concentrations of cases are across the various communities within the various counties. Darker colors representing larger numbers within a community boundary. And if you look at this then distributed a little differently, looking at numbers of cases by county 1 week versus the next, we see that some counties have had a decrease between week 30 and 31, and others have actually had an increase. County had a bit of an increase, Narrow decrease, St. Andrew, St. David, slight increase, St. George Central, increase, St. George East, increase, St. George West, increase, largely to do with that cluster activity to which we referred. St. Patrick, minor increase, Tobago, bit of a decrease, Victoria, bit of a decrease. So you're seeing some counties going up, some going down, and that sort of drives that plateau overall, same numbers across the board, because of the difference in directions in each of these locations. And if you look at that just over the last 5 weeks, we see that we've had fairly steady numbers in some counties that have gone both up and down within that 5-week period, others that have manifested more or less of a downsweep. But again, if you look at it at a county level, what you're seeing is that these variations cancel themselves out to some extent across the board, and you have similar numbers of national cases from week to week. That's what we've been seeing. And this is sort of the breakdown of trends within at a sub-geographic level. Now looking at the projections and performance, whereas we had been seeing in the month of June tendency towards a downtrend or a decrease in the cases, as we pointed out at the start of this epidemiologic update, we're seeing now that there is a little bit of an upward trend as manifested by those dotted lines, that dotted line up at the top right-hand corner of the graph. We're looking to see whether the blue bars, which are the cumulative cases, grow faster than that, or whether they maintain that sort of growth rate within that projected range. And as we see acceleration or deceleration, then we'll comment on what that reflects with respect to transmission in the population. And just to reiterate that the factors that will drive transmission down are maintenance of the public health measures, the 3 Ws, wearing a mask even after vaccinated, washing your hands, watching your distance, and of course, getting the vaccine, which is going to reduce your risk of becoming A, infected, B, severely ill, and C, reduce your risk of fatality. So with that, I'm going to turn you over to Dr. Richards.
Good afternoon to the Honorable Prime Minister, the Honorable Ministers of Health, National Security, Energy, and the Office of the Prime Minister, to my health team led by Dr. Paris Ram, and of course Dr. Trotman and Dr. Hines, members of the media, the viewing and listening population of Trinidad and Tobago. This afternoon, I'd like to provide an update on the statistics and the situation in the 16 facilities of our parallel healthcare system. And this data is accurate as of 8 a.m. this morning, the 14th of August, 2021. my colleague Dr. Hines would have confirmed that the rolling average, that is the average number of cases per day over the last 7 days, has been increasing, especially over the last 3 days. From the parallel healthcare system's perspective, we expect an increased number of admissions within the next 3 to 5 days based on the increasing number of cases. This graph demonstrates the difference between admissions and discharges across the 16 facilities in the parallel healthcare system. And we can see that over the last week, the gap between the admissions, which is the orange line, and the discharges, which is the green line, is actually increasing. And that represents an increasing burden or an increasing additional number of critically and severely ill patients that need to be managed in the hospitals and step-down facilities of the parallel healthcare system. We can take a closer look at the reasons for this widening gap. And we would note here that the number of admissions has increased over the last week, while the number of discharges has decreased. At this point, I would like to mention that we have had a slight uptick in the number of pediatric cases, especially in the Southwest RHA, which covers the San Fernando and the southern region. And there are currently 3 severely ill children that are hospitalized as confirmed COVID-positive cases. And this is a new development that we have noticed. There have been 49 additional cases, inclusive of those 3 children, over the last week. And we have also noted that we have persons who are very ill, meaning severely and critically ill, requiring oxygen, that are being admitted and spending anywhere between 12 and 21 days in our hospitals. When we look at the actual number of COVID-positive patients, as of this morning, there are 408 patients that are distributed as follows: 303 across the 9 hospitals that care for the severely and critically ill patients, and 105 at the 7 step-down facilities. We have noticed a consistent trend of 3 to 1, meaning that there are 3 times as many severely and critically ill patients as compared to recovering patients. The overall percentage occupancy of the parallel healthcare system is currently at 40%, and this has been a consistent trend that we have noted from July 15th onwards, with the exception of one uptick on the 4th of August when we went to 42%. That means that at this point in time, 4 out of 10 beds in the system are currently occupied. If we separated Trinidad from Tobago, Trinidad's overall occupancy is 41%, while Tobago's is 33%. We also look at the occupancy levels as a measure of capacity to manage severely and critically ill patients, particularly in Trinidad and Tobago. And we have noticed that over the past couple of weeks, there's only been 1 out of the 7 hospitals in Trinidad and Tobago that is above the critical threshold level of 75%. However, I would like to stress and reemphasize to the public that for this week, the greatest number of admissions were actually at the Cuba Medical and Multi-Training Facility, the Augustus Long Hospital, and the St. James Medical Complex that care for severely and critically ill patients. And these are resource-intensive facilities that require a much higher level of resources to manage patients. At our step-down facilities, 6 out of 7 are under the critical threshold of 75%. The area hospital, Point Fortin, is at 91%. If we broke down the percentages, the percentage occupancy and percentages across the levels of care, the overall ward occupancy level is at 38%. Again, this has been a more or less consistent trend over the last month. ICU is at 74%. And of course, these are where our most ill patients are managed with oxygen therapy, high-level nursing, dialysis, and so on. And HDU is at 38%. Now, the average ICU stay is anywhere between the vicinity of 12 to 21 days, and somewhat on the longer side, as confirmed by Dr. Trotman and her team. And also, the average ICU occupancy over the last month is actually at 80%. We also use as an indicator the number of persons at 8 a.m. every morning who require transfer from the accident and emergency departments of the traditional A&Es and the RHAs to the hospitals in the parallel healthcare system. And so far, and again yet over the last month, we have been noticing very manageable numbers in the accident and emergency departments. So this morning there were 2 persons at the ERHA site, 2 at Northwest, 3 at Southwest RHA, and 5 at the North Central Regional Health Authority A&Es. We have noticed an increase in the percentage or the usage of the National Ambulance System due to COVID. This has increased to 30% during the past week. And of course, with that has come an increase in the turnaround time. Ladies and gentlemen, let us not become complacent with the occupancy levels of 40% in the parallel healthcare system. The Ministry of Health continues to try our best to save lives by reallocating resources, by redistributing resources, and even adding new resources. But we all know that a bed is not a bed. If we are not careful, we will soon have more patients entering the hospital system, and the resources that we require to save lives, nurses, doctors, ventilators, dialysis machines, will eventually run out. We have done all in our part to ensure the resilience of the parallel healthcare system. However, we need now to do your part. The onus is on each and every one of us to take up our vaccines. And today, we, the health team, appeal especially on behalf of the children of this country. We are noticing an uptick in the number of severely and critically ill patients, and the Honourable Minister will share with us a plan for vaccination of children. Let us continue to be personally and socially responsible and practice our 3 Ws. Thank you very much.
Thank you very much, Dr. Richards. At this stage, I will ask the Minister to bring us up to date on our vaccination program and what we're looking at immediately in the weeks ahead.
Thank you. Thank you very much, Honourable Prime Minister, my Cabinet colleague, Minister Stuart Young, Chief Medical Officer and the medical team, Minister Hines. Good afternoon, ladies and gentlemen of the media, members of the public, good afternoon. So let me bring you quickly up to date with where we are with our vaccination program and where we would like to be and where we are going. So total first dose administered throughout the RHA and agencies sector, 449,785. That represents basically 32% of our population. So 32% of our population already have had their first dose and will be on their way transitioning to second dose. Where are we with that transitioning program? Total second dose to date, 298,481, which represents 21% of your population. We are moving quickly to vaccinate as many people as humanly possible. In the next 2 weeks, according to the schedule by which persons would have received their first dose, the next 2 to 3 weeks are going to be big weeks for second doses. We estimate roughly about 100,000 persons will be transitioning to second doses. So we'll be coming back to you next week with our other graph to show you where we hope to be with second doses and set other targets. Where are we? Let me give you some breakdown from Monday to Friday of this week, that 5-day period. For that 5-day period from Monday the 9th to Friday the 13th, which was yesterday, we would have averaged 6,300 doses of first doses for that period. For the same period, we would have administered about 13,700 second doses per day. So across the board, per day, from Monday to Friday, we would have averaged about 20,000 doses per day. 6,003 first doses, 13,007 second doses. So our capacity to deliver vaccines, 20,000 a day, whether it's first dose or second dose, is more or less robust. But we are still appealing to persons to come out for their first doses. First doses are available throughout the country. 109 health centers available for you to make use of. Our mass vaccination sites are available. 3 drive-thrus in Trinidad, 1 in Tobago. Use them. We have started our outreach about 2 weeks ago, where we are going into places of worship, whether they are mosques, mandirs, churches. We have started pop-ups. So vaccines are available. No appointment. If you want to make an appointment on our online system, you are free to, but you can walk into all 109 health centers and get vaccinated. So we are quickly and have quickly broken down almost every single barrier to vaccination. It is convenient, it is accessible, no appointment, walk in, get vaccinated. I would like, before I close, to sincerely thank, again, all healthcare workers. I mean, you have really stepped up to the plate. But in thanking healthcare workers, I also want to thank those 449,000 citizens of Trinidad and Tobago who are on their way to being fully vaccinated. Each of those 449,000 persons are now basically guaranteed of not being a fatality statistic, because all the international evidence shows that you stand a 99% chance of not dying from COVID. So those 449,000 persons are in a good place. They are also 99% guaranteed of not getting the disease at a serious level to take you into an ICU or HDU. So to those persons who have trusted the vaccination program, thank you. Thank you. You have shown the way for the rest of us, and the rest of us now have to simply follow their lead. Thank you very much, Mr. Prime Minister.
Thank you very much, Minister Dayal Singh. Ladies and gentlemen, today in Trinidad and Tobago is a good day, because I am able to report to you that with respect to the national response to a virus in a pandemic, we are in a good position to carry out what is directed as the appropriate response to the virus that has ravaged us for just about a year and a half. You may recall last year, 2020, we were facing the same virus, but we did not have a way out and a way from. Today, I can tell you, we are living with the virus, and we will be required to continue living with the virus. Because unlike MERS and SARS and swine fever and so on, that came, scared, hurt, and went, it is now clear to us, the human population, that in mid-2021, we are talking about this virus, which was called the novel coronavirus, because it came to us as a new interaction with the human population, coming from an animal population, apparently. We have to now convince ourselves that it will be around. Fortunately, our scientific population in the world has worked or has been working on coronaviruses for quite a while. So when this one broke free and came into the human population, a lot of the base work that has been done allowed us, alongside the ability to use the huge database analyses that can be done by current computers, which were not available at an earlier time. Putting those two things together, we were able to be the beneficiaries of a response to the virus. Here in Trinidad and Tobago, as recently as January, every pontiff could tell us, wherever we were located, whoever we were, that the solution to our problem, and the problem was very real and it still is very real, which is death, destruction, loss of jobs, damage to the economy. The problem that we are facing is to be solved by vaccinating the population. Those of you in the media, if you go back and check your print in January, or even December for that matter, well into February and March, that was the response that was required from the people of Trinidad and Tobago. We are required to vaccinate the population. Of course, some people didn't care that there were no vaccines available to us. They just shouted loudly, vaccinate the population. But at that time, up to today, vaccines are not easily available. I can tell you, it was our portion as a people, through the Prime Minister of Trinidad and Tobago, to have had to take the chair of CARICOM in January of this year, which was the height of the pandemic, where vaccines were known to be a good response, but vaccines could not be had. Very early in January, with myself in the chair and my colleagues at CARICOM, we had our first sessional meeting, chaired from here in this building in Trinidad and Tobago, and we issued a cautionary statement to the world that we were concerned that now that there was a solution, and even though we had a plan called COVAX, where 20% of our population could be vaccinated in the first go-around worldwide, that we saw where it was quite possible that some people would have been getting vaccines and others would not be getting it. The first quarter of this year, I could tell you it was very, very difficult for me as Prime Minister of Trinidad and Tobago and Chairman of CARICOM to be as easily mobile in other areas as my colleagues were, because Trinidad and Tobago being chair of CARICOM in this unique situation, and I dare say I'm the only Prime Minister in Trinidad and Tobago who ever had to chair CARICOM, look after Trinidad and Tobago and CARICOM in a pandemic. And unfortunately, I got no support from my parliamentary colleagues on the other side. What we got were obstructions and undermining. However, that is behind us. But Trinidad and Tobago had to speak for CARICOM. We had to fight for CARICOM, where we are part of CARICOM, but we couldn't leave the others behind in any conversation. Otherwise, that would have been another story. The bottom line was, even though we were prepared to pay for vaccines, we could not buy. And we had to literally rely on the generosity of those who initially saw us as worthy of some grants. We made applications to purchase AstraZeneca when that became available and was certified for emergency use. We approached the suppliers from in the marketplace in India. That application is still in there without actually the response was that we couldn't supply. We could not supply. In a pandemic, the singular arrangement wasn't available to us. We also had close discussions with another manufacturer, Pfizer, which sought to give the impression that they could sell, but terms were to be discussed. And of course, they concluded the conversation that they only sell into sovereigns, and sovereigns who had already bought out the production. And of course, today I could tell you we made payments in 3 areas. We made payments in the COVAX last year, I think last year in November, when we had to make, all of us countries, I think 170 countries, something like that, had to make a payment determined at a price, and to be paid by a certain time. We did what we had to do then, and then we then had to wait. Having made the payments, we had to just wait until the allocation came. Those payments were made against a background that we would be accessing 20% of our needs, right? In a population of 1.4 million, we're talking about 280,000 people. And of course, if you look at what we were paying for, we had another 80% to look for vaccines for. We couldn't even get that 20%. And of course, from this podium, you would have been told along the way how we got 33,000 once, twice, and of course a third one coming in. And that was one particular brand of vaccine. The other payment we made was to was to the African Medical Platform, where because of what was happening to us, being left out and ignored, we had to piggyback on the potential supply to the large African purchase. And it required then a lot of conversations from CARICOM, where Trinidad and Tobago was in the chair. And of course, subsequent to that, we kept our connections going with the presidents of South Africa, of Ghana, of the African Union, and so on, kept our communications going with the president of Kenya. They were all there helping us stay in the loop. And today I can tell you that the first shipment of that Johnson & Johnson vaccine could be with us sometime in the not too distant future. But that we had made an initial payment towards a large order if that was going to be our main supply. However, things have changed in the interim for the better, so it may very well be that we may not have to make that payment towards the large order, but a portion of it. So don't let that bother you too much. The Ministry of Finance, the Ministry of Health, the Office of the Prime Minister, the Foreign Affairs Ministry, we are all on this, and we'll purchase towards our needs. The largest purchase that we were able to make, which was the main available vaccine to us, was a purchase from China, where we got Sinopharm first as a gift, and then we made some purchases, and we got substantial purchases, which put us in a position today to say to the population of Trinidad and Tobago, when you put all of this together, that it is reasonable to say that anyone who wants to be vaccinated today in Trinidad and Tobago, you are more than likely to be able to be vaccinated, because we have enough vaccine to keep us busy going forward in the weeks into the months ahead. And we would like, as we said in the beginning, that the solution to our problem is to get vaccinated. That has not changed. It doesn't matter what the conversation is or who is speaking it. What has not changed is that the singular and best response to our circumstance in this pandemic is to get vaccinated. All the other conversations are irrelevant. We are now at the point where, after our program has been kicked off, when we get a reasonable supply of vaccines, to tell you today we have in hand 883,000 doses. We have in hand right now, after all we've done, we have 883,000 doses of vaccines available in Trinidad and Tobago. And ladies and gentlemen, that is light years away from where we were in January, in February, in March, and in April. We have been very open with this population. I told you that in July we would be pretty busy. There'll be a slight break. And if all things are equal, and if we worked according to plan, when we restart at the end of July, we would be in a very good position. Fortunately, I can tell you today that system has worked. From a point of view of delivery, we have got enough vaccines. We got our hands on 1,688,000 doses of vaccines. 1,688,000 doses. And remember, each person taking one of these doses would require a second dose. So if you divide that 1,688,000 by 2, because each person requires 2 doses, you would see that we got our hands on vaccines to vaccinate 800,000 people. Now, so far, the Ministry of Health has reported that of the 1,688,000 vaccines, they have utilized 804,000. And in that 804,000 would be those persons who got their first and second doses, and those persons who got their first dose and are waiting for their second dose. And those second doses, every person who got a first dose, there's a second dose waiting for you when your time comes, the 3 weeks after you were vaccinated. So in the days ahead, we encourage you, if you've already got your first dose, make sure you come out and get your second dose. It's there waiting for you. And then you will be regarded as a fully vaccinated person, and you would be helping yourself and helping the national community in the process. So that will go on for second dosing, and we have a significant amount of vaccines to allow persons to get their first dose. And once you get your first dose, there will be a second dose waiting there for you. And as we utilize these vaccines that we have now, we still have the opportunity to add to the 1.688 million doses that we have. So Trinidad and Tobago is in a good place now with respect to vaccinating its population. But only from the standpoint of the vaccine. What about the utilization? Because the vaccines themselves are useless on a shelf or in the fridge. They are only impacting the pandemic problem if they are injected into people. And I must tell you, I hate the term jab. Nobody jabs anybody with the vaccine. I've been vaccinated twice, and I had the gentle touches of two of our best nurses, one in Trinidad and one in Tobago. So I could tell you, in Trinidad and Tobago, our nurses very gently, painlessly introduce these vaccines into your arms. So stop this jab story and make it feel like there is something. And of course, there's a particular picture on the television which you should stop using, because it's scaring people. It's a needle like a jab tool, and it punctures in an arm, and it really scares people. And I tell you, as Prime Minister, a lot of people who I question, why aren't you taking the vaccine? When you get down to bar stocks, you know what it is? You're afraid of the needle. People who have been needled all their lives are afraid to take that moment of having that vaccine to save their life. Come on, people, let's get serious. The biggest problem we've had, and you'll have seen me in the middle of it, the biggest problem we've had was to getting our hands on vaccines, and we've done that. We've done that. So the smaller part of the problem is you go and lay claim to the 2 shots that are available to you. Because if you don't do that, what you're saying is that you are prepared to play Russian roulette with the virus, because you're prepared to take a chance with the virus and not give yourself and the national community the opportunity to respond in the best way that the health department has told us is our way of responding, or should be our way to respond to these vaccines. In our population, I must say I'm a little disappointed that now that the vaccines are available, the big issue now is everything else except vaccines not being available. One is that the vaccines don't meet your taste. 2, the vaccines don't meet your brand. 3, you are advised, and I must also say, in a pandemic, as Prime Minister of this country, I think I claim the right to speak this way. You see all these people from pulpits who telling people that there's something religiously wrong with these vaccines. Stop misleading the population of Trinidad and Tobago. We are all children of God. And we are all familiar with the Bible, the Gita, and the Quran. And our population, its leaders have shown responsibility in asking the population to do what our health department has said to save our lives and protect our economy and everything else we have to protect. So let's ease up on that. I could tell the population now that the report I have is that only 50% of our nurses are vaccinated. When I had the opportunity to be vaccinated, early in the program, my colleague in Barbados offered me 2,000 doses of AstraZeneca, and it was said to me that it could be used for the government, cabinet, and senior technical people and so on. I deliberately did not accept one of those doses because I said, let it go to the health department, because I am sure that there are people in the health department who are more exposed than I am. And I did not. And the cabinet did not. Those 2,000 doses went to the health department. Such was our understanding, that the health department, being in the front line, handling infected people, handling the virus in their workplace on a 24-hour basis, that vaccination was their right to be allowed to work in that place to save the rest of us. So today, I must say, I'm a little taken aback that vaccines being available, even choice and brand, and we only have an uptake of 50%. And of course, there are other conversations that flow from that. In the prison, because when COVID came out as a fashion, one of the areas that we were warned is one of the most dangerous areas to be careful with was the prison. And you know, for good reason. People in confined spaces and sharing spaces, an outbreak of COVID in there. Because don't ask me how it gets in there, because once people are interacting, it is more than likely that it will get in there, or it could get in there. Today I'm being told that by preference, only 20% of our prisoners are vaccinated. We got to make a better effort. We got to make an extra effort. We got to tell these people in the prison that they are putting their lives at risk unnecessarily. And Minister of National Security, I give you a special charge to go into the prison with people who can talk to people in the prison and let them know that this is not a joke. 20% vaccination in the prison is not acceptable. Prison officers, if prisoners are to be infected, they are more than likely to be infected by those who come to meet them in the prison. And who does that? Prison officers. And therefore, prison officers are required not to be that vector in that way and to protect themselves from prisoners who may be infected. So when I'm told that there's a 35% uptake there, that too I'm disappointed about. The Defense Force that is out there in the population doing yeoman service with the police, mixing and moving, and going home to their families all over this country. A 25% uptake at this time is unacceptable. The police is a bit better. I think the police is reporting a 43% uptake, and we are continuing to work on that. And of course, I don't have a figure for teachers, but we've made a lot of effort to get teachers, special arrangements for teachers, and I'm hoping that as we are looking towards opening of school sometime in the not too distant future, that our teachers will understand that the having of a vaccine in a country, in a pandemic, is not to be sneezed at. And of course, our students. Our schools have been largely closed for a year and a half, or just almost a year and a half. I don't know how many people are having first-hand experience and understanding of what that means. Children not being able to go to school for almost a year and a half. And I said before, and I'm going to say again, one of my biggest hurdles to overcome and my greatest concern at this stage in the management of this pandemic is to be able to allow our children, our juveniles in particular, to come out to school sometime in the near future. Today, I want to appeal to all parents, guardians, cousins, loved ones, and friends. Let us as a people do everything that we have to do to protect our children who should be in school sometime soon. What is the protection available to juveniles in the world of 2021? Over and above the normal health protocols of washing your hands and wearing your mask and so on, from a point of view of being therapeutic or responding to clinical possibilities, the singular response that we have is one brand of vaccine that's available now, authorized by the WHO, and that's the Pfizer vaccine. And I said before, when we were signing all those documents, because I did tell you, I've never signed so many documents. I've never had so many meetings on an issue. But when that was going on, I told you, if it bore fruit, and we did get our hands on this vaccine, which is WHO approved for juveniles from 12 to 18, that whatever we get, that cohort of our population will have first call on it. So I can confirm today that we do have in hand 305,000 doses of vaccines that can be used on those young people, and they will be so used if they are accepted by the parents and those persons. We have vaccines to vaccinate our children from age 12 to 18 if they're in the school, and if they're not in school, they are caught by the age group cohort. So those vaccines are for those people. And while we are looking to open schools in September, today I can tell you, now that we have vaccines to vaccinate these children, our first priority is to vaccinate them in a serious way. I have no doubt that one or two people or one or two parents will have some issue about vaccinating their children. But I am hoping and I'm trusting that the vast majority of the parents in Trinidad and Tobago in 2021 in the COVID pandemic, while your children are healthy and while your government has got the vaccines to protect your children, that you would listen to the health department and protect your children as we have done for decades. I can't recall how many vaccines I took during my primary school and secondary school days. As a matter of fact, I remember being vaccinated in high school for one of those child diseases and was laughed at. Everybody's asking me where I was when I was a child. Because vaccination is an integral part of our protection shield. It is only because in 2021, Facebook allows every interested party to be an unmatriculated expert and takes on responsibilities which are not theirs. But parents, if you don't believe me, go and ask the parents in America or anywhere else today whose children are in hospitals, talking to them on not Facebook. FaceTime. Children FaceTiming parents because the parents can't go into the ward. But FaceTiming the parents to say goodbye because these children are facing death by virus. You don't want to be the parent who refuse the vaccination that's available for free. And then one day you're told that your child is positive, the child responds badly, is in an ICU, and then you start asking, what have I done? Please, parents, don't be that parent. The record will show not the lies and the QAnon foolishness that some people are publishing about how many children die. The record will show that the vaccine is safe to be used. The risk is lower than waking up in the morning and going in your car and driving to work. The risk is lower than opening a sweet drink and guzzling it down. Ladies and gentlemen, this is serious business. Now that our children have the opportunity to have these vaccines, let us ensure that they're vaccinated, and then we can bring them out to school with a level of confidence that we did not think we could have had 3 or 4 months ago. Let us not take this for granted. Everybody will benefit, especially the children, if they are allowed to come out to school. Our plan is to bring out our secondary school children, starting first and foremost with those in the exam year. Form 4, 5, 6, we bring those out first. Then we bring out later on Form 2s, 3s, and 4s. And at this point in time, we're not entertaining the conversation about toddlers and who's going to wear a mask. That's just wasting time. We're not there. We're not down in the primary school yet. Well, we will deal with that when we get there. Right now, I want us to deal with the secondary school children who we have vaccines to vaccinate them, and we can bring them out of school sometime in the not too distant future. I'm asking the Health Department and the Ministry of Education to review the program that you put out there, and let us, before we fix the date when school is going to open, as of Monday, we're fixing the date when the vaccination program of our school children would start. And it is my expectation that they get their first dose starting Monday week, and by next week. Today is what?
Today's Saturday. It will start next week.
So I'm saying, well, that's what's called Monday week. You don't know what Monday week is? See what I have to put up with? Yeah, so the Ministry of Education and the Ministry of Health will work in tandem, and the parents and guardians in particular. I'm asking you all to work in tandem, and in the coming days, let us have a program of activity to get our juveniles vaccinated. And then when they go out to school, we'll all have the confidence that they have that element of protection that the virus, that the vaccine gives to them. I want to emphasize, because I keep hearing it over and over from those who are advising against it, the vaccine does not prevent you from getting COVID. It reduces the possibility for good biological reasons. But then, if you ever get it, then the report has shown that you will not be as clinically badly off, and you may not end up in the hospital, and you almost certainly will not be a casualty, having been killed by the virus. That is the benefit, protection from the ultimate outcome. And of course, if the doctors talk to you, I'll want Dr. Chotman, when she comes up, to talk a little bit about when you get over COVID, how you get over. Because some people get over the initial clinical expressions, but they carry with them significant scars, especially young people. So we want to avoid that. I went into a pharmacy in Tobago last week for the express purpose of looking to see what you all buy in the pharmacy, because I'm inundated by these comments about this vaccine was developed too fast, this vaccine does this, and it's not certified by the CDA and the FDA and all sort of DAs. And I went into the pharmacy and I looked at the shelves and I asked about the popular things that are bought up by in large number, paid for in foreign currency. I was amazed and in some instances appalled at what the general public was buying in the pharmacy, with nobody asking who certified that, what is the efficacy of that, in some aspects, what is the active ingredient in that, And of course, what are the side effects of using it? Who in this audience will tell me what is the side effect of using horny goat weed? Paid for in foreign currency. Available in every grocery in this country, in every supermarket, in every pharmacy in this country. But all you have to do in this country is to be a mouth and just say it's good for certain things and good for certain purposes, and nobody wants to know where it's coming from. But all of a sudden, the COVID vaccine that is required to take us from where we are to where we want to go is subjected to all kinds of analyses. Everybody's a pharmacist now. Everybody's a doctor. Everybody's an epidemiologist. Come on, Trinidad and Tobago. If these 800,000 vaccines remain in the fridge, or remain on the shelf, or you only take one vaccine and didn't go for your second, there's something called the Delta variant, which is now being reported widely in the Caribbean, which we escaped a confirmation recently in the population. We stopped it by the border. I couldn't say to you today that those were the only two instances that threatened us. Because any failure on the part of the staff on that day, and those people could have been at home anywhere in Trinidad and Tobago. So if the world is exposed and couldn't shut itself off, people with armies and navies and resources far beyond ours can't shut it off from their borders and from their internals. Why do you think, and I know why you think so, because I think God is a Trini. Because if you think so, do not gamble with lives that we could save. And the only thing that can help us save lives now is to get vaccinated. We, at the level of the government, we have done all that we could have done in as timely a manner as it could have been done. We have paid all that was required to be paid in currency. We have used our diplomatic skills. We have used everything that we could have used to be in this position. And today, I want to thank all those governments and peoples who, in our worst days, afforded us the use of their gifts. And I speak here about the people and government of India, of China, our Caribbean neighbors from Bermuda, from St. Vincent, and Grenada, Barbados. They all came to our aid with quantities of a vaccine that was more valuable than gold, until we were able to get, and we are still in that loop. I want to thank particularly the government of the United States, who worked with us. I remember being in meetings where we were told that the policy has not yet opened the door. So we had to be fighting to have the policy changed. And when the door was open, the logistics, in fact, that Pfizer vaccine, the logistics of handling it is far more complicated than any other. Because we had to deal with not only the government of the United States, but the manufacturer. And sometime, and all of this was done under requirements of absolute confidentiality, but I'm sure sometime in the future, you will see the documents that we've had to sign and the minutes of the meetings that we've had. But the bottom line is, it has borne fruit. So today we can thank the United States government for its offer, a substantial offer, of which we've got the first tranche, and we look forward to others. And in so doing, there are some special people that I wish, as Prime Minister of Trinidad and Tobago and former chairman of CARICOM, there are some special people in the United States who I would like to thank for their involvement in ensuring that we here in Trinidad and Tobago and in CARICOM, that we were not left out. I speak specifically about Congresswoman Maxine Waters of California. She was in the forefront championing our cause. Chairman of Homeland Security, Benny Thompson. Congressman Greg Meeks. Congressman Jim Clyburn. Vice President Kamala Harris. And all the technical people at the White House who worked with us, and CAFA, and of course our CARICOM staff. It took all of that to be where we are today, to say to the people of Trinidad and Tobago, we have a variety of vaccines, we have enough vaccines to keep us busy and to vaccinate those who require to be vaccinated, and we expect to get a few more. So our target is now very realistically in sight, and our program is well underway. The only missing component is that willingness of the population to accept the vaccine. Don't go trying to be brand specific and being controlled by vaccine presence. They're all doing the same thing. Do not deny yourself a vaccine because it is this brand or that. As a matter of fact, from here on in, the government will be speaking to you about vaccine dose and not vaccine brand, because we are to have vaccines in every health center and other places of service that we designate, as we will designate for our students and young people in the days ahead. Go out and get your vaccine. And as you're doing that, we will rise from the floor where COVID has knocked us down to a place where we can all be out there, and our economy is going to return to some semblance of delivery. So today, I want to say that given where we're at in all the programs, that we will allow, as we said, the retailers to open up on Monday. We expect our retail sector, that's going to be a big, big step. Bear that in mind, and remember Dr. Heinz's graphs and bars, that we are doing these things, our economy and our other activities are being done at a time when we are not at the zero level, we are not COVID sterile, there is still a fair amount of COVID in the population, and it could get out of hand if people are irresponsible. Remember, it is all about not congregating, keeping the hygiene going, wearing your mask, and just being basically sensible. And add to that vaccination. And then we could continue to do the work. So we bring out our cleaning and cleansing staff, URP and CPEP. Our roads and byways and highways are now becoming overgrown, overrun, because they're working outdoors. It is the view that they can come out now, join the workforce outside, and do the work that they do, maintaining strict protocols at all times. Where these workers were congregating to Lime, to compare their heads to hairstyle, to be covered under the same blanket, we're asking the organizers to spread out the workers, get the work done, because it can be done safely. It can be done safely, and it should be done safely, because we are now acknowledging loudly and proudly that we are living with the virus, but doing certain things that allow the virus not to get the better of us. And of course, personal services, we expect that by now you would have been busy being vaccinated. So those of you who are using personal services, it's up to your option to inquire as to whether persons coming close to you have in fact got themselves in a relative safe zone. And of course, the last thing I want to touch on, for those who are playing the Russian roulette, in this population of 1.4 million people, we have 3,300 hospital beds.
Correct.
3,300 hospital beds. That is the size of the health care infrastructure that we're working with. We have a number of hospitals, from Tobago to Point 14. But if you require to be accommodated in a hospital, you will be competing for one of 3,300 beds. We have the parallel healthcare system where we allow the population to have its normal healthcare delivery. But we've added to the system what Dr. Richards talks about every week and how we manage that. That has 1,022 beds. And of course, if you get into real trouble, how many people we have in the, yeah, we can deal with 916 of you in the ward. And if you require ICU care, 50. Maybe a little bit more if we stretch a bit. And of course, if you get into real trouble, talking about another number of tens. So don't think that I could play the Russian roulette, and if I do get knocked down, it's a given that when I get to the hospital, they'll be waiting there to receive me. They'll be waiting there to give me a bed, and they'll be waiting there to fix me. No. See yourself in a population of 1.4 million people. But the number of hospital beds available in this population is a few thousand. It's a few thousand. At best, we're talking about 6,000. Last week, and of course I know there will be those who say, well, it should be more, and it should be more, and the government, and the government, and the government. Last week, the city of Austin in Texas, with 11 million people, were reporting that they had left 3 intensive care beds. 3 in a population of 11 million people. What do you think happens then? You know what happens then? The care just isn't available. And you would have seen what happens when that care isn't available, because you would have seen it when India was in trouble. You'd have seen people gasping for breath in the hospital, in the corridor, in the driveway. And they couldn't, when they gasped, they couldn't get that breath of oxygen. That's where this virus can take a population. But don't compare us with the United States, except to learn from where they're at. Because you see, from a resource standpoint, Mississippi yesterday, 2 days ago, declared themselves in big trouble and not being able to provide the health care to the population because COVID had taken over the state. They were able to call on the federal government, because it's a huge country. If one part is in that situation, another part is not. So the Northeast, the Northwest, and so on. The government of that country could respond to that state and send them 400 doctors and 1,000 nurses. I told you in the beginning, when we started this fight, we have no one to depend on. You would have seen it in the vaccine distribution. You would have seen the unfair treatment that countries like us faced. And today, if we find ourselves in that situation where we are now unable to cope with the mass of people who would need health care, we have no federal government to call on. We have no military doctors to bring in. And I want to, at this stage, to add to the countries that we thank the government of Canada, who gave us a shipment of vaccines as well, and the very special gifts of the United States, those field hospitals, because they have played and will continue to play a comforting role to us in this fight. So I think I've painted the picture. We could do better if we get ourselves vaccinated. We could get into big trouble if we don't. The one good thing is the vaccines are available. The ball is in your court. If there are any questions, I will take them now. But before you go to questions, I'd like to ask Dr. Trotman to speak about the clinical experiences and particularly about persons who have been sick with COVID and recovered, and what long COVID is about.
Certainly, Prime Minister. Honorable Prime Minister, Minister of Health, Minister Young, Minister Hines, members of the health team, Dr. Pasram, Dr. Richards, Dr. Hines, members of the healthcare profession, from those who clean the floors, to those who lift the patients, to those who cook food, to those who tend in nursing, to those who take the X-ray pictures, all involved in the healthcare delivery, particularly in the COVID response, and of course, physicians, to members of the listening and viewing public and members of the media. I start with 3 words: vaccinate, vaccinate, vaccinate. It will allow you to live. I want to thank the Honorable Prime Minister and Minister of Health and Dr. Pasram for all of their efforts in giving us the opportunity to live. And that is by those 3 words: vaccinate, vaccinate, vaccinate. COVID-19 is a disease that can affect you from the top of your head to the tip of your toes. COVID-19 is a disease that spares no human, race, creed, age, or sex. But we can protect against it with those 3 words: vaccinate, vaccinate, vaccinate. One of the areas in the body that COVID-19 affects preferentially are the lungs. And for those who know me, my major profession as a physician governs that area with the lungs. We don't think about breathing. It's automatic. You don't think about breathing until you cannot breathe. I'm not speaking about it only as a physician, but also as a patient. Can you imagine going through COVID-19 and being affected in that area primarily? And when you think it's all over, it continues. So your regular activities, walking around, you feel short or tight with your breathing, or you feel chest pain, or you can't run with your child or pick them up. That is the experience for many people, unfortunately, who have COVID that has affected the lungs. How can you avoid that? Simple. Vaccinate, vaccinate, vaccinate. We don't think about another area a lot, but I must talk about the psychological effects of people who experience COVID-19. Your mind can be affected. Your thoughts can be affected. And then there is another particular area, and that is in your nervous system. How you feel and how you feel with certain things when you try to pick them up. You feel tingling in your body. There are now even groups that have been formed with people who have these effects of long COVID, finding a way to support each other. They found their own support groups. And we can avoid this by not getting it at all, or if we get it and we are vaccinated, that you do not have serious repercussions from COVID. I implore you all, as we continue to vaccinate, 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 that we practice the 3 W's. We're excited to be moving about, but we are at risk, and we can protect ourselves. I am happy that we have the vaccine. I'll be happiest when all doses are delivered. While we're doing that, everyone, wash your hands, wear your mask, watch your distance, Vaccinate, vaccinate, vaccinate. Thank you.
Thank you very much. Thank you very much, Dr. Trotman. It's quite a dramatic ending you had there. But let me just clarify something. When I said last week when we were here, we discussed the personal services, and we did ask that people who are involved in providing personal services, and I'm here talking about barbers, nail techs, hairdressers, domestics, and so on. We did ask you to make an effort to get vaccinated. We are hoping that you would have been taking the opportunity, and we would want to ask you to continue to do that for another week, because next week, not tomorrow Monday, but the following Monday, we intend to lift the restrictions on those services. That's what I was talking about, personal services. So let's see, just please, every health center would be able to vaccinate you, and even with one dose of vaccine, you know, we would start the process, because we know what you have been going through, and we expect you to be responsible. I'm hoping that I'm talking to the converted here, because you should have, during the last week, taken the opportunity to do so. Just want to make one point. The Ministry of Health will determine where school children are to be vaccinated, and the Ministry of Education will cooperate by getting schools, and I'm asking all those involved in the school business, principals, teachers, parents, and so, look out for where these Ministry of Health locations are going to be, because we'll do them in groups and districts, and as quickly as we can get the children vaccinated, because it requires a period of time to get the full benefit of the vaccine. So if school is going to open at day X, we don't want to be vaccinated the day before. We are holding the next 2 to 3 weeks for the vaccination program to go in, and what we anticipate is that whenever we open the schools, that the children would at least have had at least one dose, and many would have had 2 doses, because we are going to maintain the position for the next 3 weeks, and we expect to open the schools after that, sometime after that 3-week period. So we ask you to bear that in mind. And this is an exercise. It is the Ministry of Health that is providing the vaccines, and the Ministry of Education that is making arrangements to receive and use those vaccines. Right? So if there are questions, we'll take them now.
Good afternoon, Prime Minister. Rashad Khan here from Guardian Media. So you'd have listed out some major steps to be taken on Monday. The retail sector is going to be back out, CPEP and URP.
Under full protocols.
Under full protocols. What kind of assurances can you give, if any at all, that any further spike in COVID-19, regardless of if it's Delta variant or any other variant, that we would be coming back into a lockdown again?
I can't give you any assurance. This is something that is beyond assurance. I don't know that Dr. Parsham, with his long experience, can give you an assurance as to what the community at the individual level will do. What we are looking at the broader picture, that if we follow the protocols that have been working and the cautious way that we have gone step by step, even though we are seeing slight increases going in a direction that we would have been happy if it was going in the other direction. But we are prepared to follow the protocols, and we expect that Dr. Hines' numbers will be such that we can live with it. If the opposite becomes the reality, then we'll cross that bridge when we get to it.
Okay, and now we would have seen in other parts of the world, US, France, elsewhere, where businesses have taken it upon themselves to say, hey, we're only going to serve to vaccinated people. What would be your stance on that if something like that is implemented locally?
Well, I don't have a personal stance on that. I lead the government. The government's position is that we have not taken, as we did in the beginning, we did not decide to force the population into complying with COVID. You remember we had asked for masks and we got a certain kind of response. Then we had to go and make it mandatory. I think I have not seen a person without a mask for quite a while. So the people who are taking decisions, there are two things out there. One is rights and the other is responsibility. There are people who will claim their rights and there are people who will claim the responsibility of those who've claimed their rights. And all of it is being done so that all of us can survive. Different people may do things differently, and I trust that all of us will operate within the law, but there are different options available. At the end of the day, and I want to make this point clear again, at the end of the day, there's only one entity that has the responsibility of looking after everybody, and that is the government. And the government is quite prepared at this time to rely on the population's sensible response to something called a pandemic. It's a life and death situation, right? I don't know who the next person is going to be. None of us is immune from COVID. There's nobody in this room with all the health qualifications and training they have. None of them could say, I know that I am safe from COVID and that nobody can negatively influence me or my family. No, because we don't know when the infection will take place and under what circumstance. Look, I came here to this podium, I don't know if it was sanitized by somebody before me, I hope so. I got COVID. I had no idea how I got it because I was following the protocols. Fortunately, I did not reach the stage of requiring, a response to my clinical condition that would have put me in a hospital and so on. Some people I know in my own family have ended up in the ICU and could have had a very bad outcome. So this is not something to be picking and choosing about, and nobody's going to give you any assurance. Any assurance you get from anybody on this is not worth anything.
Okay, could I follow up?
Yes.
Okay. On the topic of vaccinating school children, do we have a number or a percentage of these categories that you would have identified who are first to come out that we would like to see vaccinated before we could bring them out?
Well, I just said that we'll be, as we move children to school, God willing, we would go with the fifth form, the exam form, and the sixth form. There's a certain number of students there, but in the vaccination program, we'll do it by age, from age 12 upwards. So I think that will roll out in that way. So once you are in school and you are 12 years above, you should get vaccinated. And you take all the people up to age 18, whether you are in or out of school. If you left school at 16 and you are not in school, get vaccinated because we have an arrangement there for you. So as you talk about students, we are talking also about people in that age group of students, even though you're not in school, age 12 to age 18. So if you are out there working at age 17, you could get vaccinated now with vaccines that are specially available to you because of your age.
Okay, no, what I meant to ask, and I'm not sure if I phrased it wrongly, but is it that we're looking for a specific percentage of these students? So we say, okay, 25% of these students would have received it, so we will go ahead, or we'll wait until we reach about 60, 70%?
Well,
that's what I meant.
that I would leave that to be answered by Dr. Parasram. But from the point of view of head of the cabinet, we would want a significant proportion of the population of students to be vaccinated so that the virus cannot very easily move within them and multiply within them. Doc?
So I think we set a target with any group that we would like 100% of them to be vaccinated. We know that is not a practical and reasonable thing to expect, but we want the majority of the population to be vaccinated because of the way children interact there's a higher risk, and because of the environment itself, there's a higher risk of spread from one person to the next. So as many people as can be vaccinated in that age group, the better the outcome will be in terms of spread if and when we return to that type of environment. I don't want to put a number to it to say 70%, 50%, 60%. We really want everyone to come out in that age group, be vaccinated. We will return to that environment much sooner if the large majority of that population is vaccinated, regardless of the prevailing epidemiological situation. If you get low numbers, you have to wait until the epidemiological situation in the country goes to a better place before you could bring them out. So you have to bear those two things in mind.
Yeah, so you see, we have an option, it's no choice, because if we don't get the population vaccinated to that level, for that decision to be made, then what we are choosing is children not going to school. And what I tried to say early on, that children not going to school is not our preferred option. We want children to go to school, and we know what we have to do to get them out to school relatively safely, and that is to vaccinate them.
Just making sure. Good afternoon, everyone. Kimberly D'Souza from TTT News. I have a question for Dr. Richards, actually, just to get a bit more information about the 3 children who are ill. I know you won't be able to share all the information, but can you tell us the ages of the children? Has contact tracing started for the children as yet? And, you know, what parents can do at this time right now to prevent their children from getting the virus? Because you did mention there's an increase in children contracting the COVID-19.
So thank you very much for your question. Due to patient confidentiality that, of course, we practice, we can't go into too much details or any sort of details regarding the ages of the 3 children. We can say that they are being taken care of at the hospitals in the Southwest RHA, which I would have shared with you. As far as the prevention of children contracting the COVID-19 virus, this is where the onus lies on the parents. We have repeatedly asked parents and members of the population to please accept the vaccines as they are safe, accessible, and very available. Because in addition to the vaccine preventing or reducing the risk of us, the adults, of contracting the COVID-19 virus, it protects those of us who cannot receive the vaccine at this point in time. So I hope that this has answered your question, and it's brought a bit of clarity. Sure.
Is it that 3 out of the 49 are children, or 49 are children? Because I think you said...
Oh, 3 out of the 49.
Of the severely ill patients are children.
Yes,
okay.
Yes. Thank you very much.
Hi, Dr. Richards. So considering what we know about Delta variant, and considering that we haven't ruled out the possibility that it could in fact be circulating within our population and we haven't detected it as yet, is it that samples are being taken from these children that we've noticed the increase in to be sequenced for Delta?
Yes, I can confirm that genotyping sequence testing is being done by the University of the West Indies in collaboration with the Ministry of Health. Okay, thank you.
So going back to the questions from before, sorry, but you basically are hoping people are responsible to get vaccinated so that they go back out to work and that kind of thing. But the ECA and the trade unions are calling for some kind of national vaccination policy because, you know, questions of liability and risk of litigation is coming up. Is the government at all considering in the future entertaining any such policy?
There is no absence of policy. You know, the policy is that getting vaccinated is voluntary at this time and not mandatory. I don't know what other policy exists other than that. In that mandatory, in that voluntary arrangement, that is why we are appealing to people to get informed, know the facts, and use the facts to make what we consider to be a defensive decision. So,
sorry, but the parents are the people who have to make the decision to get their children vaccinated, or the 12 to...
Not just parents, some people are with guardians, they're not all with parents.
And the adults. So is there going to be some sort of cohesive program with the Ministry of Health and the Ministry of Education to, information and giving information about this? How is that?
Thank you. Thank you very much. Let me state from the onset, vaccination of children in Trinidad and Tobago is not new. Let me state that. Because unfortunately, I was waiting to come on to CNC3 last night. And the interview before me was the president of some newly formed group. And I was a bit taken aback to hear him say he is not going to allow vaccination of children at tender ages. Now, pediatricians in Trinidad and Tobago vaccinate children at age, 3 months? At 1 month. And that has been going on for decades. And this is the type of misinformation that goes out there. So vaccinating children from day 1 after birth, 1 month, is normal, standard practice across the world. And what shocked me about the statement is that this vaccination is for adolescents 12 years to 18, not young babies. You know what pediatricians do every day in their office? Vaccinate babies. But all of a sudden, the vaccination of 12 to 18-year-olds, when I was in school, we used to get vaccinated without parental consent. The nurse would come, vaccinate you, and you go home, and that was it. So the point I want to make is that let's not find every excuse in the book not to protect our children. And let me just make one last point. We went down to DB, we sent the camera crew down to DB, and we showed the questions at the press conferences. And one of the food vendors was saying, why should I vaccinate when I have a 5-year-old at home? The question is, you need to vaccinate because you have a 5-year-old at home to protect the child. That is one of the principles of herd immunity. For those who cannot be vaccinated, if enough people around you are vaccinated, you are protecting those who can't be vaccinated. Like right now, those under 12. So the Ministry of Health and the Ministry of Education, together with UNICEF, will be doing some sensitization for parents. But let me close by saying, vaccinating babies and children is long-standing medical practice around the world.
Let me just join this conversation here to say one thing. There are always options. The vaccinating of the population, and in this case, specific to the juveniles, that is an option. It is an option that we have. For those who say, forego that option, what exactly are they offering you? It is to stand and wait on the virus and see what it does. That is the option. Let me repeat that. For those who have a problem with the vaccination response as the option that the state is advancing, the option that they are asking you to follow is to stand and wait and see if you will be selected by a deadly virus. A virus that has already killed 4 million people. That is the option they're offering you. And it is for you to decide whether you want that option or you want an option that gives you a chance of being defended against that virus by vaccinating yourself and your charge, whoever is under your charge as a child, and you may be a guardian for. It's as simple as that. In fact, some of the conversation is that COVID is a hoax. Some of the conversation is that it's an ordinary flu. Which ordinary flu killed 4 million people in a year? Some of the conversation is that there's some, some demonic arrangement. And some even take you to the Bible to look for its origin. Absolute poppycock, if I may quote Daily Knock. And I'll tell you worse than that, for those of us who have had the responsibility of looking at the populations, you know what you're being advised now? That this COVID occurrence could be a regular occurrence. Because there are other possibilities of viruses coming our way in the same way and having the same kind of effect, disrupting the country, disrupting the world's economy, disrupting your progress, because you first and foremost want to stay alive. And for those who have a problem with the vaccination as a response, I want you to ask them, what is the alternative? And since when we didn't know that vaccination was the way out, in January, in February, in March, and in April, you were on my case every day. Get the vaccine, get the vaccine, get the vaccine. And now we have the vaccine, I have to be listening to all that foolishness. Let's get serious. And you see those young people, I take personal responsibility for them. And if I'm wrong, you let me know. But I believe that the vast majority of people in Trinidad and Tobago are right-thinking, reasonable citizens. And I believe that parents will want their children protected. So come the start of this program, I genuinely expect the majority of parents to get their children to get another vaccine, because those same children would already have had a number of other vaccines. Right? I'm sure those children who are in line to go out to school, and I desperately want to get out to school, I'm sure they've been vaccinated, and I'm sure if I ask the average parent anywhere from Toko to Charlottesville, they can't tell me what is in the vaccine. What they tell me is that they trusted WHO, they trusted PAHU, they trusted the government, and they wanted to protect their children when those children were born and when they were nurtured. So what is all this? We will know if we are in trouble when the minister reports how many vaccines we have in hand which are not being utilized. And I trust that we will not come to a point where we can conclude that after all we've been through, after all the damage has been done to us, there's light at the end of the tunnel, and there are people asking us to back into the darkness. There's no other sensible, reasonable, scientific alternative now to respond to COVID-19 in 2021 than the vaccines that have been authorized for that purpose. Thank you very much.